I, I'm just amazed. I glanced at our clock, and we only have about 7 minutes left.
Oh, wow, okay.
And
didn't-
I'd like to go to healthcare.
Sure.
And I'd like to bring up, because after all this that
Yeah.
stimulated you to run, this healthcare debacle, Lois recently went before a very friendly audience. She was a nurse.
Yes.
She went before a group of doctors and staff at Cottage Hospital. Can we bring up the news press headline, and I'd like your comments on it?
Yeah, that was a pretty stunning event. That you're standing there. Healthcare supposedly her expertise, and
She voted for it.
And she voted for it enthusiastically. We really wouldn't take any criticism at all about the bill. We said, no, we're doing this. It's a leadership vote. It's going to happen. We need to do it. We have to do something. And to vote for this thing and to be so ill-informed about what was actually in the bill, and to admit in a moment of rare political candor that it was a big gamble indeed. You know, gambling with our health care and transforming the best health care in the world to, go off on this flyer and, construct this unbelievably complex system that is going to drive costs up. It's guaranteed. It already has. My company, we just got our open enrollment period for healthcare is now. And we just were told, hey, your healthcare bill is going to go up 30%. I was like, 30%? Holy cow. Yeah, we used to complain it would go up 5, 6, 7% a year. You'd think that was a lot, but 30%. So I started looking into it, and what I found was a lot of provisions that were in this healthcare bill took effect immediately. For instance, one of them, removing the cap on damages. So if you had a policy that, say, had a lifetime cap of $2 million, guess what? When you come up to renew it, it's going to have an unlimited cap. And an unlimited cap costs more than a cap of $2 million.
Absolutely.
And the annual amount that they're going to pay out, there's all kinds of nasty surprises in this bill.
And they're factoring in, they've got to start collecting to have reserves for what's going to happen when it comes in full bore. And part of that is, that people don't realize is, these insurance companies are also regulated. They can't become, they can't not have money to pay the bills.
This is true.
So they have to factor it in now.
All of these fare increases, people need to understand, they have to go to the insurance commissioner in California and go and show them the actuarial computations to show that to work.
To show, not to defend her that it's a big gamble, but to show the mess. You had a chart.
And, can you guys bring that up?
Yeah. And did you have one that you
I do actually. And
let's put it up on the screen.
So if you can zoom there.
Tell us what this is.
Well, this is your new healthcare system, believe it or not. And this is all the different committees and groups and people that are going to be involved in the delivery of the healthcare system.
And the big kahuna is the Secretary of Health
and Human Services. And they're writing, I mean, you couldn't make this up. I've seen microprocessors that don't have designs this complicated. In the real world, something that you can't explain, is too complicated to explain, is too complicated to work. This can't work. This, only in Washington, D.C. could they come up with something like this and, with a serious face and tell us this was going to cut costs and streamline healthcare. It's absurd what they've done here. This is a bureaucratic train wreck. We had a cost problem, not a care problem, and now they've made the cost problem worse, and they're going to degrade our care through this kind of nonsense.
You're elected. Now it's next March and April. How do you stop this? You can't pass a bill repealing it because the president will veto it.
This is true.
And you won't. There's no way you're going to be able to get
big enough majority
to override its veto.
Probably not, unless
so how would
the rest of Democrats get religion? There's a couple of different things that can occur. The House of Representatives, by our Constitution, writes the checks. All spending has to originate in the House. And quite simply, all these different groups and the 16,000 new IRS agents and all these things.
Wait, 16,000? Oh, that's to arrest me if I don't buy health insurance.
Yeah, and collect all your 1099s you have to do every time you spend $600. But there's so much just wacky things in here. But if we don't fund the implementation of this as a practical matter, the 16,000 IRS agents and the money to fund all these different groups and boards, et cetera, then it's, as a practical matter, going to be impossible to implement and enforce. And then in 2012, hopefully we'll have a new president. This really needs to be repealed. This is going to destroy our healthcare system, and we're going to end up with everybody on Medicare, which is the design of this thing, and Medicare is already bankrupt. It has a $37 trillion unfunded liability as we sit here today, and that's guaranteed to go up.
Well, even in this, before your company quits providing insurance, so people have to go on Medicare and Medicaid, I think the initial program would put about 16 million new people into the Medicaid system.
This is true, yeah. A lot are going to the Medicaid system, which is even more bankrupt than the Medicare's. And
Well,
by the way,
it bankrupts the states.
it bankrupt 30% of California's budget is Medicaid. We call it Medi-Cal here in California. That's 30% of our budget. Is federally directed spending that we have to provide health care to people in the state. So this everybody's going to end up on this because here. Day one out of the chute, rates are going up 20, 30, who knows how many percent. Different companies, some companies are going to say, we can't afford it. We're cutting your insurance. Or they're going to say, we're upping your deductible, your copay, we're getting less insurance, whatever. And you're going to get less. So at the end of the day, the result of this bill is you're going to pay more and you're going to get less.
And so we've got to guarantee that Congressman Watson's going to vote to...
Absolutely. Well, this deserves to be repealed for two reasons. One, the manner in which they passed this, ramming it down our throats when it was crystal clear the American people wanted nothing to do with this bill for months and months and months before they did this. On that manner alone, that is not the way this country is supposed to operate. It deserves to be repealed. And then it's just a terrible piece of legislation.
We've got a ton of issues and 29 seconds.
All right.
Time flies. Before the election, I'm going to have you back, and we'll spend a little less time on you and more time on the issues, but I wanted people to get to know you.
Great.
And I think it was very enlightening.
Thanks. I really enjoyed it.
They sent Davy Crockett to Congress not because of the issues, but because he was Davy Crockett.
Because he was Davy Crockett.
And they maybe should send you to Congress because you're Tom Watson.